Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. I'm talking with you from my office my medical practice office, I should say. Actually, let me get this elevated up here a little bit better. Sorry to be running a few minutes late tonight, but that's the way my clinical day has been going, unfortunately. So I I forgot my headset today, so it may sound like I'm more in a box than I normally do, but I hope you still can understand me, and we'll get through all the information here. So for those of you that are coming back again, welcome back. I'm glad to see you keep getting some value out of this. And for those of you that are new here, there's a couple ways you can participate. Number one, you could write a question to me. And where you can write that question to me is through the chat box over on the lower part of your screen. I believe it's on the right-hand side of your screen. At least it is on mine here. Be aware that when you do post a question, it goes to everyone, okay? And so although I've left the ability for you to chat back and forth, I would prefer you don't do that, because if you chat back and forth, then that's going to clog up the questions, okay? So I'd prefer that you don't do that, okay? Anyhow, so one way is to write your question. This format works best for shorter questions. And in fact, if they're too long, I just won't take them. Okay, so just be aware of that. Second way you participate is seeing what questions other people ask and then seeing what kind of responses I give to those. Okay. And so I talk a lot, sometimes too much, but I hopefully gives you some good information. I am creating a recording of tonight's webinar as usual. And my intention is that I will get that out to you tomorrow morning, somewhere around 9:30 a.m. Seattle time. Okay, so Pacific Standard Time. Sometimes I run a little bit later than that, but I'll do my best to get it out to you. I have to do some brief edits on it, and then I try to create a video summary so that you can, using on YouTube, can timestamp your way through it, basically. Okay, all right. So the other thing just to be aware of during the webinar tonight, for those of you that are participating in the live version of this, you actually will get to see the questions on your screen. So it makes it a little bit easier. For those of you that are listening in on the recorded version, you can't see the questions. I don't get to show those to you, but I do read them out loud. So that's why I'm reading them out loud for those of you that are in the live version here tonight. Okay. All right. So without any further ado, let's go ahead and take our first question here. Hello, Jacqueline. Let's see. Hello, Dr. Ross. I have mold toxin and chronic Lyme with persistent systemic inflammation and suspected muscle atrophy from Lyme arthritis and fibromyalgia-like pain. Peptides are a hot topic these days. I have the opportunity to start a peptide blend called Glow to reduce inflammation and repair damage. This is a GHK-Cu plus BPC 157 TB 500 blend. This is a sub-Q medication. Question: what would be the advantage of sub-Q versus BPC peptide capsules you carry in your store? Would the sub-Q be more effective and work faster? Also, I understand that BPC 157 is more efficient when combined with TB 500 copper. Is that correct? Would I get the same results from BPC 157 capsule alone? Thanks. All right. So it depends on what you're trying to do. So BPC 157, everyone, is a peptide that is naturally made within the intestinal lining. And peptides are basically are composed of amino acids. And if many of you may know, amino acids are the building block of proteins too. But what makes a peptide different than a protein is that a peptide is classified as having 50 or less amino acids, and anything over 50 is called a protein, okay? The peptides basically are natural substances made in our body. For the most part, they're natural substances. And there is this one called BPC 157 that's made in the stomach lining. Probably the reason it's made in the stomach lining is to help regulate function of the intestines downstream, heal any injury to the intestines, and help the intestines work better. Okay, that's what it's made for. What is observed, though, is that it is useful at repairing tissue injury, like muscles, tendons, and joints, even nerves. I have found benefit in doing that. It has some weak antimicrobial activities. Most people don't experience any killing from it, but it does have some weak ones. So be aware of that if you're a very Herxheimer sensitive person, as you start BPC 157, sometimes people can get into a small Herxheimer reaction with it as well too. It has the ability to help your mitochondria, your cell energy factories work better. It has some support abilities on that. And it has some immune regulation abilities as well too, and may result in a better balancing of Th1 and Th2 inflammation. All right. So we can use it for many different reasons. When I look at BPC 157 versus the other peptide options that are out there, I kind of look at BPC 157 as the Swiss Army knife. It's kind of the starting point of where I have people start. Okay. Now, as to whether you're going to get better benefit from doing the injectable versus the oral, I don't know. No one's really done head-to-head studies on that. I can't tell you. I can tell you that the oral does get absorbed, and I have had people in my practice doing the oral BPC 157 with good results. In theory, you might get better action by doing injectable because you're definitely getting it absorbed. Okay, it's injected basically, right? But I got to be honest, no one's done head-to-head studies on it, and BPC 157 is one of those that does seem to work quite well in an oral format as it gets absorbed well. In terms of this opinion that people have that it has to be combined with TB500 and copper, I think that's an opinion. I don't think there's any science that backs that I'm aware of. And I have had good results just using BPC 157 alone. All right. I will tell you that BPC 157 alone is a supplement. Therefore, you're not required to have a physician prescription to get it, which may make it a little bit more cost effective as well too. And I believe it's going to be cheaper in the pill form compared to what you can get in an injectable form. In terms of the product I recommend, if you're getting orally, I like working with a company called Integrative Peptides. I think that they've been around for a while and they have good quality products that I find good results out of. Okay. All right. And if you're looking at where you would find integrative peptides, if you were to go to, I'm going to do a quick screen share here. All right. So this is my treat line by Marty Ross MD, of which I run Marty Ross MD supplements out of here. The peptides can all be found under this Integrative Peptides tab if you're looking for my product descriptions. The other way you can get to where you can purchase them is to click on the peptide store. And when you click on this, it actually brings you over to my section at Integrative Peptides. Okay? All right. Let's see. Oh, there we go. Had to figure out how to get back to seeing you guys after I took a brief interlude there. All right. So anyhow, I hope that gives you some useful information. Can BPC 157 be used to build muscle mass? I have seen it help in that situation before. And so, yeah, it could. It could. Probably one of the big ways that it's going to work is it just does tissue repair in general, but also it supports the mitochondria function. So it would mitochondria your energy factories. If you can rebuild mitochondria, that gives more energy for cells to work and cells to grow. Okay. All right. Good luck to you, Jacqueline. Hello, Trish. Hello, Dr. Ross. I am treating with herbs since my appointment with you, but I now feel mold is in the way. Landlord working with me, but in the meantime, can I start in with a nasal spray? Heard one called Xlear, and should I go with fluconazole or itraconazole? Thank you. So there are different schools of thought about whether you need to use anti-fungals, anti-mold spore agents while you're also dealing with mold toxicity. So let's talk about mold toxicity, all right? So when you are living in 25% of people have a genetic predisposition that if they are living in a building that has mold, if they breathe in the mold toxins, those mold toxins get absorbed into their bloodstream through the lungs and they get trapped within the blood system, all right? 75% of us, if we happen to breathe in mold toxins from the world around us, what happens is our immune system sees those mold toxins that get absorbed through the lungs into the blood, and immune cells will tag those toxins to be broken down, and other immune cells will come in and destroy those mold toxins. So 75% of us could walk into a cloud of mold toxins, breathe all the stuff in, and never be bothered by it, okay? The issue is that 25% of people are programmed in a way that they can't break the mold toxins down. And so what happens then is these mold toxins, the next line of defense would be the liver. The liver can't deal with them either, and eventually excretes them into the bile system, your gallbladder and the bile system, and then they work their way out into the intestines, and then they get reabsorbed again, okay? So the issue is not a mold spore problem for most people. It's a mold toxin problem, all right? And it's a circulating pool of toxins that keeps going around and around. Now, for a small percentage of people, and in my practice, maybe 20% of the time, there's a small percentage where contributing to the mold toxin issue is that when somebody is in a building full of mold, they may breathe in mold spores, and those mold spores may colonize their nose passages, and the mold spores may colonize their intestines. And in those locations, they can start producing toxins. And so therefore you start becoming your own toxin brew pub, okay? My experience in my practice, though, is that 80% of the time, I never have to put somebody on a mold spore killer. And all I need to do to get over their mold toxin problem is to put them on substances that bind the mold toxins within the intestinal tract to start pulling them out. The times that I decide I am going to do something about clearing them from the nose passages and the intestines, that is the spores, is if I've treated somebody for about 6 months and I go back in and I redo their urine mycotoxin studies, and I find they still are peeing out a lot of mycotoxins and they're not getting better with just using binders alone. Then I start wondering, are they colonized? And at that point, I will wind up putting them on something to kill the mold spores within the nose and with the intestines, okay? So in my practice, my starting point for when somebody has mold toxicity is not to focus on mold spores, because most people don't have a mold spore problem. Everyone with mold toxicity has toxins trapped in you, and about 20% have mold spores colonized that contributes to that. That's in my practice, okay? I mean, I can give you stories of people who have gotten well without ever putting them on a mold killer. Just mold binders, okay? All right, so a good starting place if you have mold toxicity is start using binders. You want to put people on substances that are going to grab hold of those mold toxins that have worked their ways out into the intestine so they don't get reabsorbed again. And a general binder that can bind up all kinds of things, all kinds of toxins. A product I like using is a product by Biocidin Botanicals called GI Detox Plus. It has a little plus sign on it. And it's made up of a number of items in there that will hold on to and grab hold of a number of toxins. And I've had people have good improvements doing that. When somebody starts, I have them start at 1 pill a day. And if they can tolerate, I have them go up to 2 pills 1 time a day. Be aware as you start moving toxins, it may flare you up because that can trigger more inflammation from cytokines. The active moving toxins can trigger more cytokine inflammation. So in addition to being on a GI detox, I want people on agents that support decreased levels of cytokines. And one of my things I like to do is actually have people on curcumin. Curcumin which is a component of turmeric, is very useful at getting inside white blood cells and limiting their production of cytokines. And so that sometimes can be helpful in a situation like this. And so I'll have people take 500 milligrams 3 times a day of curcumin. The curcumin product I'd like is a product made by Thorne called curcumin phytosome, 500 milligrams 3 times a day. Regarding the GI detox and regarding the use of any binder, whether it's a prescription binder or an herbal binder, there are some timing issues, okay? So keep in mind, these are binders, okay? So they bind things. They can bind your drugs and your supplements as well too, right? So the timing issues is that you need to space out, all right? So I tell people to stop their medicines and their prescription medicines and supplement medicines beginning about 30 minutes before they take their binder, and then they can resume taking them again 2 hours after they take their binder. Keep in mind that anytime we eat, our gallbladder will contract, and the gallbladder is where things from the bile system get stored before they get moved out into the intestine. So one thing you can do to kind of improve the chances of your binder grabbing hold of those toxins that are stored away in the bile system is to go ahead and eat about 30 minutes after you take your binder. And the idea is when you take your binder, it goes to the stomach, and about 30 minutes later, it's worked its way into the small intestine where the gallbladder releases its stuff, okay? So that transit time takes about 30 minutes for it to get itself all the way down there. So in terms of timing, let me kind of go back to that again. You want to stop all medicines and supplements 30 minutes before your binder, take your binder, and about 30 minutes later, have a small amount of something, anything, a handful of nuts if you want. And then 2 hours after your binder, you can start taking medicines and supplements again, okay? All right. So regarding your question then about whether to do fluconazole, itraconazole, the answer is no, that's not where you start. Now, I know some of my colleagues do, but I don't think they're right. Because for 80% of the people in my practice, it's not a mold spore problem, okay? All right. The other thing about mold toxicity you need to make sure you've done is to make sure that you have looked at your home to make sure you're not continuing to be exposed from your home environment as you are doing. And I would just, that's a good thing to do as well too. Okay. All right. All right. Good luck to you, Trish. Hello, Chris. Let's see. Hello, and hope you're doing well. I am. Thank you. The question concerns narcolepsy in a person with known tick-borne infections. Any insights at all? This person had partially treated Borrelia, Bartonella, and possibly has Babesia. Never positive, but now we know about Oticoli. Because he was bitten many times over a period of 10 years in Hudson River Valley, exhaustion for 15 years, and now getting a diagnosis of narcolepsy. But we wonder if treatment for TBDs might relieve some of the daytime sleepiness. You know, it's a hard thing to say. So there is no science that I have seen or that I'm aware of or that has been done that links tick-borne infections to narcolepsy. Okay, no one's done that science. So I can't tell you for sure. What I can tell you is that narcolepsy is an illness of the central nervous, the brain, basically, and the sleep centers of the brain. And the two infections that are tick-borne infections that might impact that area would be Bartonella and Borrelia. I have not, in my practice, when I have had people that have had narcolepsy and have had Borrelia or Bartonella, I have not seen improvements in their narcolepsy as we treated the Bartonella and Borrelia. That's not to say other people will have a different story. I'm just saying in the limited number of people I've been treating this for about, I guess we're coming up on 20 years now. I've only had maybe 2 or 3 people in that time that had narcolepsy as part of it. So it's not a big population, okay? But of those 2 or 3, I didn't see anyone that got better with their narcolepsy as we treated for the tick-borne infections, okay? But I have to acknowledge that there could be some relationship to Bartonella and to Borrelia. Okay? All right. Good luck to you, Chris. Or good luck to your friend. I think it's... All right. Let's see here. Hello, Carlota. Let's see. I'm Carlota from Spain. I have Borrelia and Babesia. Welcome here, by the way. My symptoms are not very severe, mostly digestive issues and low energy at the end of the day. I don't know how to plan my treatment considering that my budget is small. I already follow an anti-inflammatory diet. Based on your book, I should start with a detox, curcumin, glutathione, etc. But I don't know how long I should do this before taking antibiotics. I also don't know which type of bacteria killer would be best for my case. Herbal, dapsone, disulfiram, classic antibiotic combinations. I'm afraid of damaging my microbiome as I cannot take IV treatment due to my budget. Thank you for your time. All right, let me just see here. All right, so just some things for you to consider. Okay, so first of all, I agree with your concern about protecting the gut microbiome. And so, but I will let you also know that IV antibiotics are not good for the gut microbiome either, okay? Just because it's in an IV doesn't mean it gets into the intestine. It still gets to the intestines, all right? And in fact, the bloodstream delivers quite a bit of antibiotics to the intestines. So IV prescription antibiotics are also harmful to the gut microbiome. When we look at the anti-herbal or prescription antibiotics, or even IV antibiotics that are going to have the least chance of interfering or disturbing the gut microbiome, that would be herbal antibiotics. They, in my experience, and I think the experience of my colleagues, when people are on herbal antibiotics, we rarely see people get intestinal yeast overgrowth. And intestinal yeast overgrowth would be a sign of disruption of the good microbiome. All right, so we rarely see that happen. And so these days, all things being equal, when somebody first starts treating with me, I do discuss with them the option of doing oral antibiotics, combination oral antibiotics, herbal antibiotics, even dapsone protocols. I don't recommend disulfiram anymore. There's too much chance of permanent injury to your nervous system from using it. And frankly, we just don't see that it has held up in time as being an effective treatment, okay? But if you're looking, when I counsel people to do initially, and this can even be with severe symptoms, you have mild symptoms, but severe symptoms, is I encourage people to first start with herbal antibiotic protocols to protect the gut, okay? Now, when it comes to the chances of herbal antibiotic protocols working versus prescription antibiotics, let me just look at some facts about that. So in my experience, when it comes to Borrelia, the Lyme germ, I find that herbal antibiotic protocols can work about 85 to 90% of the time. And that is the same chance that any 2 prescription antibiotics you might go on to at the same time have as working as well. Okay, so for Borrelia, I think you have as good of a chance at getting improvement and getting over it doing herbal antibiotics as you do prescription antibiotics. For Bartonella, I think you have about an 85% chance that any prescription antibiotic regimen you start that targets Bartonella will work. And I think you have about an 80% chance that herbal antibiotics are going to work. So there's a 5% difference, okay? And I would say that's similar for Babesia as well, too. The prescriptions may have about a 5% better chance of working than the herbals. But on the other hand, the advantage of going with herbals first is that you don't hit the gut. You don't hurt the gut. So that's where I suggest people start, okay? And the regimens I like that are all herbal that can target all 3 germs at the same time, Borrelia, Bartonella, and Babesia. Well, actually, to target Borrelia and Babesia, here's what I would do. I would do a Cryptolepis. Cryptolepis is an herb that we know from laboratory studies is quite effective against Bartonella and Borrelia. It's useful at targeting both growing and hibernating or persister forms of those germs. In addition, it is the strongest herb that we have for Babesia. Okay. Now, with Babesia, I like to dose it really high, though, a strong dose. All right. And so the way that I like using it for Babesia is to have people work up to taking 5 milliliters 3 times a day. Okay, you heard me correctly. That's the size of a teaspoon, or 5 milliliters 3 times a day. I would probably start at a quarter of that dose, and about every few days try to increase it, working up to 5 milliliters 3 times a day. All right. And then I would probably combine that with Japanese knotweed. And that I would dose at a tincture, a 5-to-1 tincture, which means it's 5-part plants are extracted in 1 part of alcohol. And I would do that as or I would work up to 30 drops twice a day. And then if you can find it, I would try to find a preparation that has cinnamon, clove, and oregano oils. They are quite effective at Borrelia persister growing and getting rid of biofilm. And the clove in there is useful against Babesia as well too. The source that I usually recommend of getting herbal products for my patients that are, that I consult with that live in Europe, there is a website called limeherbs.eu, okay? And that they would have a lot of these things that I just talked about, okay? All right, that would be my suggestion for you. Good luck. Hello, Bill. Let's see. Dr. Ross, Happy New Year. Happy New Year back to you too. Thank you. Let's see. I have the 3 Bs. I have been on an antibiotic herbal plan for about 8 months and started feeling okay. I recently added Boluoke to my regimen. I've been taking 2 pills first thing in the morning. I haven't been feeling as well. I'm presuming Boluoke is doing its job. How would you recommend I proceed forward with using the Boluoke? How do I want to be dosing where I'm feeling a Herx? What's the maximum pills I should be taking? And how long is somebody normally on the Boluoke? Thank you. All right. So everyone, Boluoke is a group of enzymes that come from earthworms. I always laugh at that one, but yeah, we have people eat earthworms as part of their management here. And so these group of enzymes from earthworms are effective at breaking down the blood clotting protein called fibrin. Fibrin is a component of is part of 2 problems that we find in tick-borne illnesses. First, Bartonella and Borrelia have the ability to cover themselves in a slime layer called a biofilm. Biofilm has a number of components, but one of the components is the skeleton that holds a biofilm together. And that skeleton is made up of fibrin. All right. So taking Boluoke can break down that fibrin in the biofilm, causing the biofilm to fall apart so that your antibiotics and the immune system can get in and attack those germs better. Okay. So biofilm occurs in Bartonella and Borrelia. Boluoke, lumbrokinase, because it breaks down fibrin, may help with that. Okay. All right. Number 2, we think that Bartonella and Babesia, not Borrelia, but Bartonella and Babesia, have the ability to wrap themselves up in your blood clotting protein and creating what are known as germ fibrin nest. Okay, I don't know if that's technically a medical term, but that's how we refer to them. And so, in these nests, then they stick themselves on your blood vessel walls, and they're walled off. And antibiotics can't get them as easily. The immune system can't get it as easily. So breaking down fibrin could help with that as well too, okay? So the problem is when you start Boluoke is a brand of lumbrokinase or a lumbrokinase product that is made by a company called Canada RNA. The problem when you start breaking down your biofilms with it and you break down your fibrin nest with it is you've exposed your germs and you may be getting a bigger Herx reaction as you get greater killing, okay? And so generally, I do not advise that people start at 2 pills right away on a Boluoke. I usually will suggest they start at either 1 pill every other day or 1 pill daily. And that they only add a 2nd pill in a day if they are over Herxing and they're back to their baseline. So I suspect you're kind of overdoing it here, basically. So keep in mind, to get better, you don't necessarily need to Herx and feel terrible. You just need to take enough to move you forward. If you were my patient and you came in to see me, I would be suggesting to you that I think that you're being a bit aggressive and that you might want to go ahead and decrease that back down to 1 pill a day. Keep in mind, excessive amounts of cytokines over time can hurt you. They actually can suppress the immune system, when limiting your ability to recover from this, okay? And the cytokines can sometimes cause tissue injury as well too. So I would be careful with that, okay? All right. And how long is somebody on this? So usually once somebody starts it and they see that they're getting some benefit, in your case, you're having a Herx, which means you're getting benefit, I would stay on it through the end of your treatment. You're going to have, we already know that you're getting some benefit by removing fibrin nest and removing, I presume, removing biofilm. So I would probably stay on it. Yeah. Okay. All right. Good luck, Bill. So everyone, I want to just point out a couple articles for you to take a look at here. All right. So in terms of fibrin nest, all right, so I just typed in fibrin nest up here in the search bar, and you can see I have an article on lumbrokinase that comes up, okay? All right. The other two places that I mention fibrin nest and what to do about them is in my Kills Babesia, a brief guide, where I talk with you about the importance of dealing with fibrin nest. I also talk about it in the ultimate Bartonella management guide and why it's important to use something to break down the fibrin nest for Bartonella too. Okay. All right. And then again, Bartonella is part of biofilms. I should have a whole article on biofilms. If you want to read more about biofilms and the other things you could do for biofilms, there is an article I have called Biofilms. Or actually, there's this article here called Biofilm Gated Communities, okay? All right. Okay. Let's see here. Hello, Shirley. Let's see. Good evening, everyone. I hope you are well, Dr. Marty. I am. Thank you. Babesia. Why did those hideous red marks, exactly what are they, please, become more plentiful after months of antibiotics? Is there any way naturally or with a dermatologist to have them removed? How do I get rid of this Herx? Seems to be lasting for months. Advice, please, to get past the Herxing without a chance at all of any further Herxing in the process. I mean with potent supplements. What else can we do to boost our immune systems in general? I learned so much from you. Thank you. You're welcome. Exactly what are they, please? Become more plentiful after months of antibiotics. Is there any way naturally or with dermatologists to have them removed? All right. So they are, that's a good question. What I will tell you is that I think they are dilations of your red blood vessels that occur as a result of Babesia. I'm not clear as to the mechanism. What I usually see in my practice is as you get rid of Babesia, they will go away. In theory, though, you are correct that dermatologists should be able to remove them. But I wouldn't do it while you're still in the middle of treatment. I would wait until you're done because usually treating Babesia, killing Babesia is going to get rid of them. If you've developed a whole new crop of them, I would want to be asking you a lot of other questions to see, is that an indicator that Babesia your treatment is not working effectively, okay? So a sign that your Babesia treatment is not effectively killing and removing your Babesia could be, one thing could be, you got more of those red spots, okay? But I would also want to look to see, is there anything else suggesting it? I wouldn't ever make a decision that Babesia treatment isn't working just based on one thing, okay? So I would go back and relook at Babesia symptoms that we attribute more to Babesia. I mean, they may still have relationship to your other tick-borne infections, but I would be looking at the following things. Number one, are you more fatigued? Number two, do you have an increase in air hunger? Feel like you can't get air from time to time while you're at rest? Number three, do you have more nighttime sweating? Number four, do you have more increased in headaches? Number five, do you have increasing amounts of deja vu experiences? As that's a kind of a symptom that sometimes will get a lot worse when you have active babesia as well too. All right. So I'd be looking at that. Okay. All right. The other thing, when you say you're herxing for a long period of time, that either means that you're being way too aggressive with killing, or it means your current regimen isn't working and you're feeling badly, which is not technically a herx. It just means you're feeling badly because your immune system is overproducing inflammation chemicals called cytokines. So let me talk about cytokines for a minute. So cytokines are chemicals that are made inside of your white blood cells. They're made by white blood cells to help when the immune system sees an infection or a toxin, to help turn the immune system on to deal with that problem. And the immune system will make these cytokines to cause more white blood cells to be made, to help draw those white blood cells to where the infection is, and to help those white blood cells work better, okay? The problem is in certain disorders that the immune system is not doing well getting rid of, the immune system will keep trying harder and harder, and eventually it makes too many cytokines. And too many cytokines make you hurt all over, make you feel worse, make you more tired, disturb your sleep, make it so you can't think, et cetera, et cetera. All those symptoms that we call Lyme disease symptoms and mold toxicity symptoms and yeast overgrowth symptoms, well, guess what? They're actually all excess, majority of them are excess cytokine symptoms, okay? Now, when you start killing germs, the immune system will see the dead bug parts and react by making more cytokines. And we call that a Herxheimer reaction, okay? So you'll feel worse as you start killing germs. But Herxes should be limited to when either you change antibiotics, you increase the dose of the antibiotics, all right, because it's a killing reaction. And so if you've got increased worsening of symptoms that have gone on for more than a couple weeks to 3 weeks, that may not be a Herx. It may be that your treatment is inadequate and you are more inflamed with cytokines because the treatment is not working, all right? So I'd have you you may need to sit and talk with your healthcare provider to help sort that out. In terms of things that a person can do to limit cytokines, either to limit Herx reactions or to limit the inflammation as a result of these increased cytokines, there's a couple of things that I like to do with people. Number one, I'd like to have people on a curcumin. I mentioned it earlier tonight. Curcumin is a component of turmeric. It gets inside of your white blood cells and turns down their ability to produce cytokines, all right? And again, I like using a liposomal curcumin, and the product I like using that is a liposomal curcumin is a product by Thorne called curcumin phytosome, 500 milligrams 3 times a day, okay? And if somebody is herxing, like they get worse as they introduce antibiotics or they increase the dose of the antibiotics, and by antibiotics, I mean herbal and prescription, okay? Then what I would do is I would increase it up to 1,000 milligrams 3 times a day, all right? Now, again, curcumin works inside of white blood cells. It blocks production. But the other thing you can do to help improve Herxheimer reactions and also increase cytokines is to lower the signaling that tells white blood cells to make these cytokines. And the signals that tell white blood cells to make cytokines are oxidation agents that are made by the immune system. So a potent antioxidant can go a long way to help you lower the signals that tell your white blood cells to make the cytokines. And what is a potent antioxidant is glutathione. Now, many of you may think of glutathione as being a detox chemical, and it is. It helps the liver to detox, but it's also a very strong antioxidant. And so what I like to do with people that are having a hard problem with their cytokines, either from herxing or just because their immune systems aren't getting the job done adequately, is I'll do the curcumin 500 milligrams 3 times a day, and I'll have them take glutathione. Glutathione also, I like it to be liposomal. The reason I like liposomal curcumin and liposomal glutathione is the liposomes, these which are little fat bodies, help increase the absorption, all right? The curcumin unknown is not well absorbed. Turmeric that it comes for is just horribly absorbed. Glutathione gets destroyed easily in the stomach lining unless you do something to protect it. And it's the liposomes that do that. The product I like on liposomal glutathione is made by Research Nutritionals. It's a product called Trifortify. The reason I like their product is clinically, I've seen it work great. Number two, they've got research showing marked increases in glutathione inside your red blood cells, decreased oxidation of lipid membranes. They've done research on that, improved immune system function. These are all things that happen on their product that they've shown through research. Okay, so that Trifortify is the product I like doing for that. And the dosing I would do for that is a teaspoonful once a day. If somebody's having quite a bit of herxing and that's not helping, I might increase it up to 1 teaspoon twice a day. Okay, so a basic cytokine control regimen would be the curcumin, 500 milligrams 3 times a day, along with glutathione, a teaspoon a day. And if that's not working well enough, then you could go up to 1,000 milligrams 3 times a day of curcumin and 1 teaspoon twice a day of the glutathione. Okay? All right. Good luck to you, Shirley. Hello, Tanya. Hold on here just a minute. Okay, let's see. Hi, Dr. Ross. It's good to see you again. It's good to see you too, Tanya. Although I can't see you, I'm glad you're here, though. I'll put it that way. Hopefully you remember me. Since I last saw you years ago, in addition to the chronic Lyme and co-infections you diagnosed me with, and the other ailments and symptoms I already had and still have, MCAS, headaches, migraines, chronic fatigue, joint and muscle pain, all over body pain, neurologic symptoms, so many other symptoms, I have been diagnosed with, I believe, Ehlers-Danlos syndrome, SFN, POTS, mast cell, osteoarthritis. Many of the issues and symptoms overlap. What's the best way to know what is what? Some pain I can tell what it is from. Others, it is hard to decipher. I have been working on all these issues, but stopped taking Lyme and co-infection drops at some point. Should I be adding these back into my regimen of supplements and meds? Not a lot has changed except worsening issues with my body. I know there's no way to see if Lyme co-infections have improved or not. What do you do? Any suggestions? Thanks for all you do. So Tanya, that's a lot. And it's a lot for me to decipher in this kind of a format because, I understand that all these things are contributing, and your question is, what do you address and how do you address it first? All right. I can't figure that out in this kind of a format. I would need to ask you a lot of questions to help me figure out what's the best response for you. All right. I will make one thing you may want to consider doing to get more direct input from me would be to set up an appointment with me. And there's a couple ways to do type of appointments I offer. One is an educational medical consult visit where I'm not your prescribing doctor. I'm not your ordering physician. But with that, I can visit with people anywhere in the world. For me to prescribe for you, though, or for me to order tests, you need to first come out and see me in my office in Seattle. If you are a person that lives out of Washington State, I'm only licensed to practice medicine in Washington State. If you are a person that lives outside of Washington State, for me to keep caring for you after I initially prescribe and diagnose, and if you want me to remain your prescriber, you would need to come in to see me each visit, meaning fly into Seattle, okay? All right. For people that are Washington State based, after that first in-office visit, I can see you by telemedicine and still be a prescriber and diagnoser, okay? All right. So the issue is I can't prescribe or diagnose or order tests if you live outside the state. I can't do that at all. I can't do that unless you see me for every visit, okay? All right. So if you want to know where you go to make an appointment so that I can help you more, and this is for anyone who wants more direct advice from me, let me go ahead and just show you how you do that. Okay, so this is my practice website, martyrossmd.com. My practice is called Marty Ross MD Healing Arts. And in terms of looking at the type of appointments I offer, take a look at my appointments tab here and learn and book now, okay? And basically, you're going to see that there are two types of visits. I do a full medical service, and then there are my educational medical consult visits. Read through the descriptions of both of these so you know what you're getting into, and then click on the book now button and you can set up the appointment that way, okay? And at this point, because I only started being back in business in November, I have a lot of openings. I don't know how long that's going to last though, okay? But I'm welcoming patients that need help to set up time to visit with me, okay? All right. All right. And then to your point, your question about I'll just make one point. So in terms of determining if infections are still active, we don't have 100% accurate testing, but there is a way that may give you some information, okay? So in general, when we look at testing, we can break our testing down into two groups. We can do what's known as indirect test and direct test. And let me tell you the differences between those, okay? An indirect test means we're looking to see if there's an immune reaction against that germ. And so the immune reactions would be things like an immunoblot, an ELISpot, an Armin lab, those things, an IFA, those are antibody tests. And the ELISpot is looking to see as your white blood cells react against a germ, okay? So those are indirect. They're just looking to see, have we had an immune reaction against the germ, all right? Indirect testing, I don't think, is an accurate indicator of telling us where you are. Okay. Then the other thing we can do, and our testing ability here has gotten a little bit better, is we can do what is known as direct testing. Can we actually measure the germ? Can we see the germ? Okay. And indirect testing would be things like getting a blood culture. Well, culturing is not that good when it comes to tick-borne infections, so we don't do that. Okay. There's some companies that offer it, but it's not good. All right. The second way that we can do is we can look to see if we can measure the DNA of that germ, and that's something called PCR testing. The trouble is we know for PCR testing for Lyme that it will only find Lyme if it's in you 50% of the time. I'm sorry, 30% of the time, 30% of the time. So it's not a good test for Lyme. For Bartonella and Babesia, it may not be the best test either. And the reason is it's hard to find those germs in the blood at times, okay? All right. Then the next best way that we have now is what is known as a microscope exam using fluorescent markers that attach to the genetic material of the germ. And there's two ways that's being done. IGeneX runs what is known as a Bartonella and a Babesia fish test. And then there's a newer lab called T-Labs, where they're doing a microscope exam, applying a genetic marker for both Borrelia, Bartonella, and Babesia. All right. Now, the thing about direct testing and these microscope and fish testing I was just describing is if it comes back positive, it actually means you got the germ living in you. Okay? They're seeing the germ. Okay. The problem is, though, is that these tests may not always see the germ when it's there, because the germ literally needs to be in that allotment of blood that you draw from the arm or your leg or wherever you're drawing it from. When you put the needle in, that germ needs to be swimming by. Bartonella and Borrelia don't readily live within the bloodstream. So you may miss those. Babesia may be a little bit better because Babesia actually lives in your red blood cells. So I sometimes, when I'm confused about whether somebody's got an active infection or not, I will suggest getting a T-Lab microscopic exam, or I may suggest getting an IGeneX fish test with the idea in mind that if it's negative, it doesn't prove to me the germ is gone. But if it's positive, I've got evidence that that germ is still in there and I should keep treating for it. Okay. All right. That's my approach on that. Okay. All right. Good luck to you, Tony. Hello, Sally. See bilateral chronic hip pain. Do you see this with Bartonella? You could see hip joint area pain with Bartonella. Could it occur in the hips? Yes. But I would also want to look for other causes of bilateral hip pain too. So I would be doing probably, if I've got somebody who's having a lot of trouble and it's not getting better, I might get hip x-rays to look and see, is there any signs of osteoarthritis? Osteoarthritis, a big cause of it is you just wear down your cartilage over time and you get bone rubbing on bone. That tends to occur at your big, mostly used joints of your knees, your hips, sometimes in your wrist that can happen too, sometimes your thumb joints, okay? Your overly used, not overly used, but your greatly used joints are most susceptible to this happening, okay? Now, I have to admit, though, that if you have Borrelia infection, we think that Borrelia does attempt to burrow itself into your cartilage, and in doing so releases a bunch of enzymes so that it can dig its way in and hide from blood flow and hide from oxygen in that blood. And so having a tick-borne infection may speed up cartilage injury, right? But usually the major component that's leading to osteoarthritis in somebody with tick-borne infections is going to probably be due to just common wear and tear, all right? Now, if you do get x-ray, and one way to evaluate that is with an x-ray. It can tell you whether you've got signs on your x-ray in your bones that suggest osteoarthritis. So these days, I've been having some good success in my patients that have osteoarthritis of their knees, of their hip joints. This joint's a common one people get, and that is working with a product that has some celery seed as well as boswellia in it. And what these two herbs do is they decrease inflammation within the cartilage and the chondrocytes. And what happens is chondrocytes, which grow cartilage, if they're inflamed, they start helping destroy cartilage. But if they are uninflamed, if there's no inflammation, if that's gotten under control, the chondrocytes can start making cartilage again, okay? And so there's been some studies done of a product that has celery seed extract and boswellia in it. It's a product called Cardigenics. And their studies, they've done some double-blind controlled human studies. And there's about 4 of them now, I believe. And of the studies, here's what's been found. Number one, there can be cartilage thickening seen on x-rays. In one of the studies, they looked to see, are there increases in markers showing cartilage production? And in the studies, there have been increased cartilage production markers. People on this, I think about 40 or 50% report pain reduction, and about the same percentage of people, I believe it's the same percentage of people, report increased mobility, okay? It usually takes about 3 months of being on the product, but it can give some good results. I've seen good results in my patients. I've recommended that too. I started recommending it when I was doing my community group a while back, and a lot of people there reported improvements. It is something I've used even for my own osteoarthritis, and I've had some good improvements too. So again, the product name that has the celery seed and has the boswellia in it, it's a product called Cardigenics. Let me show that to you here real quick. All right, so I'm just going to go ahead and type the word up here. And that's the name of it right there, okay? All right, now if you're looking to see if I have any other articles about joint pain and what to do, take a look at this article called Joint Pain and Lyme, Natural Ways to Beat Inflammation and Osteoarthritis, okay? It's a pretty comprehensive article. I even talked about prolotherapy, platelet-rich plasma, etc. It's in this article, okay? I think I even mentioned stem cells. I talk about BPC 157 in here as well too, okay? All right. Good luck to you, Sally. Hello, Jacqueline. Hold on here just a minute. All right, let's see. Hello, Jacqueline. Let's see. What are some mast cell activation syndrome stabilizers that are tolerable for sensitive people? I've tried cromolyn sodium, Claritin, quercetin, stinging nettle, and Zyrtec, and was not able to tolerate them even in small doses. Okay. So there's a couple components. So when you are reactive, when you react to things, there can be two components, okay? One of those is that your mast cells, your allergy cells, are overly turned on, and they wind up producing too many histamines, but also too many cytokines, okay? All right. So the idea of doing something to stabilize the mast cells could be helpful. All right, I'm going to come back at what you might try for that in a minute, okay? The second thing that can happen in people that are reactive to all kinds of things, kind of people, right, is there can be a problem that develops where a part of your brain that's called the limbic system gets stuck in an on-reactive position. So the limbic system is a part of your brain that controls reproduction. It controls getting away when we get scared by something like running away. So it controls our fight or flight response, okay? It controls reproduction. It determines when we should eat. But if it gets overly stuck on, you wind up existing in this fight or flight response to about everything that happens. So you take a drug and it feels just a little bit off. It triggers this whole nervous system response, a fight or flight attack response that exacerbates everything and makes it a lot worse, okay? So in people that have marked sensitivities, you've got to do two things. You've got to go stabilize the mast cells if you can, but you also need to get the brain retrained so it's not as reactive. And that's called limbic system retraining, okay? And there are a few programs out there that I have worked with my patients before. Each of them is a little bit different, and you'd have to go to their websites and see which one resonates best with you. One of those is a program called Primal Trust. There's another one called Dynamic Neural Retraining System, or DNRS, by Annie Hopper. And there's a third way called the Gupta method. And these are all ways that you can work with mind-body techniques and other techniques to reprogram your brain so it's not as reactive. So unfortunately, when you get to this situation, it is not always about taking a thing. It's about retraining some of that reactivity that's in you, okay? All right? All right, now, in terms of things, and then let's look at mast cells. So when you have mast cell activation syndrome, we have to look at what brought that on. So mast cells, everyone, are your allergy cells, but we now know that they just don't release histamines when you're allergic to something. They actually release histamines if they've been triggered to do so by having chronic infections, having mold toxicity, okay, by having too many yeast in the intestines. All those things turn on your mast cells, all right? So in terms, and so I just want to make you aware of that. Now, one of the big things that turns on your mast cells is environmental mold exposure, which is separate from whether you got toxins in you. It's just being irritated by mold in your environment. So one of the other things that I suggest that people do is make sure that they're not living in mold. All right. If your home is loaded with mold, that's triggering all that mast cell too. Okay. All right. And then in terms of things to take, so there are two things you have not mentioned here that you might want to look into. One is to take a compounded medication, which is called low-dose naltrexone. Naltrexone is a narcotic blocker. It's used in people with alcoholism and drug abuse issues, but at a low dose, that's why we call it low-dose naltrexone. It's manufactured as a 50 milligram pill, but when we use it in this kind of situation, we're going to start sometimes. I try to have people take 1.5 milligrams, work up to 4.5 milligrams a day. But in people that are super sensitive, like you're describing, I might start at zero point 0.1 milligram a day. I want you to hear that. Normally I would start at 1.5 milligram a day, but in super sensitive people, I might start at 0.1 milligram a day. Okay. Now, what this does is low dose naltrexone, which is a narcotic blocker, helps us in a couple ways. Number one, it binds to a group of receptors that are found on your mast cells called toll receptors. And when it binds to these toll receptors, it actually stabilizes the mast cells. Okay. Right. So it could help. And the thing that's nice about it, because you can work with a compounding pharmacy, you can get to a low dose that you can tolerate. Usually you can. Okay. All right. And so I would usually start it maybe in somebody real sensitive at 0.1 milligram a day. And after a week or two, if they're tolerating, I would go up to 0.2 milligrams, and I would keep just trying to gradually increase that up. The other thing you might consider working with, but I would probably go with the LDN first, is to look at using a peptide called KPV. Now, KPV is manufactured in an oral form by Integrative Peptides, and they have two products. They have a pill and they have a liquid. I would not go with the liquid because they've got a flavoring in there that could be something you couldn't tolerate. Okay, all right. But the pill is just KPV. The fillers that are in there look to be pretty safe to me, as I've worked with other people. The only thing I want to make you aware of, though, KPV, even though it's a peptide, has some very weak antimicrobial properties in some people, not everyone. All right. So usually what I'll have people do with the KPV, a full dose of it would be 1 capsule twice a day. I would never start one of my real sensitive people on that. I might start them have them open up a capsule, divide the powder in half, and try to take a quarter or a half capsule full of powder to start with and see if there's going to be a reaction to it. And then try to gradually work up to at least getting 1 capsule in a day. Okay. All right. So you might go with the LDN first and then come back and try to get at the adding in the KPV, get your dynamic neural retraining system or the Gupta method or primal trust going, and make sure you're cleaned out your environment, that you are not sitting in mold that's tickling everything up too. Okay. All right. I know it's an awfully complicated problem. I get that it is. Let me show you, I'm going to do a screen share here where you can read more about this too. Let's see here. So I think about two or 3 months ago, I released an article about sensitivity. Yeah. Take a look at this article called How to Manage Extreme Sensitivity and Lyme Disease or Mold Toxicity for more information. Okay? All right. Oh, in terms of that KPV I was telling you about. So again, get the capsule variety of it, okay? There is a liquid, but you would want to go the capsule variety of it. All right. Oh, I guess I didn't screen share that, but anyway, I was showing you the images of it, but anyhow, okay. Good luck to you, Jacqueline. Hello, Hudson. Let's see. I recently had 14 tests for the 3Bs with IGeneX. The results are indeterminate for Bartonella henselae. The IgG bands 23, 31, 41 are positive, but still considered indeterminate. No mention of Babesia. This is confusing. Do I continue to treat regardless? Hudson, I'm not clear if you've written down the band numbers correctly here, because usually on an IgG, the 23, 31, 41 combination should be considered to be positive. I would want to go back and look at the numbers you're reporting, or to clarify that they really did if they didn't put positive down on that, because I would consider that to be positive, okay? In terms of deciding to treat or not, you have to consider a number of things. I mean, and I can help you look at this in a educational consult visit if you want to. I'd be glad to do that. But in diagnosing and determining whether somebody has these infections still active, you consider 4 things. 1, is there a risk of having gotten these infections? And a big risk would be having a known tick bite, okay? Other risk would be putting yourself doing activities that put you in proximity to ticks. So living in New Jersey, I would consider to be high risk. About 99% of those ticks carry Lyme out there, okay? Hanging out up on the dunes up in out in the Cape, high risk, lots of Lyme up there, okay? Being a hunter, being an avid outdoors person, even in low endemic areas, could put you at risk, okay? All right, so you got to look at what's the risk of having gotten these infections. Number 2, do you have symptoms that are suggestive of these, all right? So you could have a positive test, but if you have no symptoms, that doesn't mean you really have infection. It could be a false positive test, or in the case of antibody testing, like the immunoblots, it just may mean your immune system got rid of it. All right. So a test doesn't prove you have it. You got to look to see, are the symptoms there too? Okay. And specifically for Bartonella and Babesia, I'm going to look at a few things. For Babesia, I'm going to look to see, is there air hunger? Is there night sweats? Is there racing and skipping of the heart? Is there lightheadedness on getting up? Is there increased amounts of deja vu? Those are things I'll consider. Now, you don't have to be positive on all those, but I'm going to look at those, okay? And do you have low energy would be another one too. For Bartonella, the things I'm going to consider that tell me from a symptom standpoint that these infections might be there would be any type of neurologic syndrome, so neuropathies, including numbness or pain nerve syndromes, tremors or shakes, neuropsych issues on the psych side, like ongoing anxiety, depression, OCD, sudden change in behavior when somebody got sick with something, okay, PANS or PANDAS, for instance. I'm going to consider whether Bartonella is part of it, and having pain on the balls of the feet, and air hunger also can be part of Bartonella. So I'm going to look and see, does somebody have enough of those to say maybe it's Bartonella? All right. So you're going to look at, is there a risk of getting them? Do you have enough symptoms to say they are there currently? All right. Number 3, you're going to look to see, do you have supportive tests? Now, notice the word I said, supportive. A test does not prove an illness. A test is just another clue. And sometimes that clue can be wrong. It can be wrongly negative, or it can be wrongly positive, right? Which is why we have to consider, do you have enough symptoms that say it's here as well too, all right? And then the 4th thing I'm going to look at is, are there any physical exam findings? But the truth is, when we come to tick-borne infections, there are really not many physical exam findings that say for sure it's a tick-borne infection, okay? A bullseye rash right after a tick was attached, now that's a physical exam finding that definitely says Lyme. But beyond that, we really don't have many other findings that say for sure this is Lyme, okay? All right. But the 4 things I'm going to look at is, what's your risk? Do you have enough symptoms? Do you have some supportive testing? Keep in mind, supportive testing sometimes is wrong and sometimes it's right, okay? And then the last thing is, do you have any physical exam findings? And I'm going to look at all that together. It's a big puzzle. And I'm going to look at it and say, gosh, this looks like Lyme because you are a deer hunter, you live in New Jersey, your testing is negative, but you got all these symptoms that say it. I think it's Lyme, okay? Anyhow, if you want my help helping to figure that out, I'd be glad to look at that with you. Consider doing one of those consult visits that I have, okay, my educational consult visit. All right. Good luck to you, husband. Hello, Charles. Hello, Dr. Ross. I had a 2-year repeat vibrant tick-borne test and found that the latter test had significantly higher IgG on 2 species and 3 proteins. Borrelia guerini, OPC, and Borrelia, I can never say that one. Is this statistically significant? And could it mean I really do have a new tick bite infection? I have felt dramatically worse. IgM has never showed an elevation. My MD is not concerned because the IgMs are being in a range. All right, so the IgG levels do not have any relationship to whether the germ has gotten more active or not. When there's studies that have been done looking at IgG levels, they can kind of fluctuate up and down. And so there is not a known relationship. Okay. So I personally would not get too concerned by it. If you are feeling worse, then you need to start looking at why. And so I would be wanting to look at, what do your symptoms tell me? Do you have enough symptoms to say Bartonella? Do you have enough symptoms to say Borrelia? Do you have enough symptoms to say Babesia that we might want to treat for those? I'm going to want to also, especially when somebody has been doing better and then they get worse, one of the things I want to always look at is, did they develop too many intestinal yeast from having been on herbal or prescription antibiotics? So what the relationship there is, remember, towards the beginning of the webinar tonight, or earlier, maybe not in the beginning, but earlier in the webinar tonight, I described these things called cytokines, right? And cytokines are the chemicals made by your immune cells when they see germs, all right? So not only do they make it when they see tick-borne infections, or do they make cytokines when they see mold in your environment, or mold toxins in you from your environment, all right? But they will make increased cytokines if suddenly all those yeast that normally live in your intestines take off and start growing like crazy because you were living on antibiotics, all right? So one of the number one reasons people show a decline after they've been doing better, about 80% of the time in my practice, if I just ask enough questions, I can tease out that it's probably intestinal yeast overgrowth. And what you do then is you treat the intestinal yeast overgrowth. And for the majority of those people, clearing the yeast out over a month or two gets them back to their baseline, either gets them 100% well if they came in and they think they relapsed, or it gets them back to going forward again with their symptoms of tick-borne infections, okay? All right. I can't emphasize that enough, how important it is to look for too many yeast if you've declined, okay? So some symptoms to look at that suggest yeast overgrowth. One is a decline, all right? Number two, increased gasiness and bloating. Number three, having sugar cravings. Number four, if you have sugar cravings and you indulge it, do you feel worse? Do you feel significantly worse? Okay. Number five, if you're a woman, having vaginal yeast infections. Number six, skin changes, and specifically getting more pimples and acne, or having a worsened rosacea, or worsened psoriasis, or worsened eczema, more rashiness. Those are things that can indicate too many yeast in your intestines, and it's the skin reaction to too many yeast living in the intestines. Okay. All right. All right. So anyhow, I hope that gives you some useful information. Good luck to you, Charles. For those of you that are interested more in what I was just talking about, take a look in my Lymology guides in my yeast section. All right. And here's an article you can look at to help you figure out, is it too many yeast? I reviewed the symptoms I'll look at, but you can find it there. Okay. Notice this article that says manage a therapy crash in tick-borne diseases. This is where I talk about look for yeast, look for yeast, look for yeast. Okay. And then somewhere in here, yeah, here's my article on how you get rid of yeast called Kills and Prevents Yeast, a brief guide. Okay. All right. Hello, Marianne. Let's see, after 10 months of trying to figure out what is wrong with me with skin lesions, I did IGeneX testing and have antibodies for Bartonella, Henselae, Cantana, and Vinsoni. I just started your herbal antibiotic protocol a few days ago. How will I know when to stop, and will I always test positive for these antibodies? You may test positive for those antibodies for a long time, maybe forever. You may. And so the end point is, do you get better? All right. I would also, if I were your patient, I know they biopsied and they found antibodies in there, so they're assuming the skin lesions are from Bartonella. They may be. But as I said earlier, skin issues develop when you have too many intestinal yeast as well, too. So take a look at the article I have on trying to figure out if you have too many yeast, too. Okay? All right. Good luck to you, Miriam. Hello, Jordan. Let's see. Any options if I am having mold symptoms and suspect mold in my home, but I absolutely cannot move? That is a tough one. All right. There are people that treat mold toxicity out there that will tell you they won't treat you until you move out of that house or until you remediate it. I'm not one of those. I think you can stay there, but I think you're going to have a hard time getting well. You can be on binders, and those binders, if you take enough of them, should be able to help remove what's in you and start pulling, and they could start removing the pool of toxins that are in you. And if you take enough, they may be able to help drain out some of the new stuff coming in. But that may be taking them 2 and 3 times a day. That can be really hard to do. You could try to get some HEPA air filters, which would presumably be able to filter out those toxins. But the toxins go everywhere. It's hard to deal with them when you're living in. So I understand what you're saying. It's very difficult because especially if you're tied up in a house, but gosh, you could stay there, but you're going to have a hard time getting over it. Okay. All right. Good luck to you, Jordan. Hello, John. I'm interested in doing the education evaluation. I was looking at scheduling, but couldn't figure out if the times are in Eastern Standard or Pacific Standard. It doesn't have any labeling as to which time is. Since I'm in Eastern Standard Time, wanted to see if I would cover it. That's I'm not sure why this has become one of those headaches for me, because when we check, it does show. Oh, I know what it is. If you put I understand. So my scheduling program is something called Booksy. And if you have put your address into Booksy, it will display your time zone. It will even it'll say Eastern Standard Time, or it'll say Pacific Standard Time, okay? But if the only thing you put in was your telephone number, it doesn't know to locate you out there, okay? But to answer your question, these are all Pacific Standard Time, okay? And when we have changed, because of this issue we're having with Booksy, we have changed so that when you get notified, when you get the confirmation email, it says on there, the schedule time is in Pacific Standard Time. So at least the confirmation email will let you know that. But I may have to go back and see what I can do to change it so it's clearer that for those that have not put their address in, that these are Pacific Standard Time. Okay? All right. Good luck to you, John. And I look forward to visiting with you. Yeah. Hello, Dahlia. Let's see. I'm on Crypto Plus, Nutramedics, BRL Atoba, Quicksilver Scientific Cat's Claw, VMAX, and Cellwell Guducci. Also on Biodisrupt, Boluoke, Toxin Pole, GI Prime. I have UTIs every 3 months, no problem with yeast after Can Defense. Is my condition Lyme or Bartonella? I'm positive for Babesia with many co-infections. I can't tell. I would need to be able to ask you a lot of things about your symptoms. So unfortunately, Dahlia, I can't tell. If you do want it more direct intervention, consider doing a consult with me. I'd be glad to help you that way. Okay? All right. And I've showed you earlier tonight, I showed you how to schedule an educational consult visit with me. In case you forget, I'll just do a quick screen share here. So again, this is my clinic website, martyrossmd.com, Marty Ross MD Healing Arts. Go to here, click on that. It brings you to my appointments page. And then down here, you can read about my full medical service or educational medical consult. click here to book now. Okay. All right. Good luck to you, Dolly. Mary Ann asks, so what do you do if you don't have a gallbladder regarding binder timing? You don't have to be as concerned about it. You're basically getting a slow drip of your bile into the intestines at all times. So you just take it. You don't necessarily have to eat anything to help cause gallbladder contraction. Okay. All right. Hello, Natasha. Let's see. Hello, Dr. Ross. New here. Welcome here. Wondering if you've seen regressions every 21 days in your practice. My adult son with autism and tick-borne infections diagnosed 11 years ago. It has been almost a year of cyclical regression, stops eating, talking, toileting, and sleeping. Can go without sleep for 3 days. Does this sound like anything you have observed, and with what infection? That's a great question. It's an interesting question too. We do see a cycling pattern that happens with Borrelia. And it usually is a worsening of whatever the underlying problem is on a monthly or every 2-month basis. We think, and I'm saying think, we don't have the science that proves this, but the Lyme doctors that I trained with, and based on my experience, we think this is due to the replication cycle of the infection. You get a greater replication about every 4 weeks of Borrelia. That doesn't happen with Bartonella and with Babesia because they replicate every 24 hours. You don't get this buildup of replication or all replication happening at the same time on a more prolonged basis the way you do with Borrelia, okay? So if I see that, if I see somebody that's having worsened muscle pain, worsened cognition, worsened whatever, every 3 to 4 weeks or every 8 weeks, I'm thinking this is a Borrelia problem, okay? All right. Good luck to you. And the neuropsych stuff would fit in that too, okay? All right. Good luck to you, Natasha. Good luck to your son. All right, let's see here. I think that's it for me for tonight, everyone. I've enjoyed being with you here again. And as you know, we do this for about an hour and a half, 3 Thursdays a month. And so I know I was off the last 2 weeks, but I'm back here again. I will be with you again next week. And I will be with you again the week after. Wait a minute, am I with you next week? I'm at a conference next week. I think I'm actually off next week. I'll have to go back and look. I am at a conference, and if I didn't schedule that off, I am out next week, but I will be with you the following 2 Thursdays, I believe. Next week, I am at a conference on dementia and brain fog. And I'm looking to see what kind of new ideas I get for dealing with that. But so I will not be with you next Thursday. And I'm just double checking my calendar here. Yeah, so I'm not with you next Thursday. I will be with you on the 22nd and on the 29th. So we still get 3 Thursdays in for the month. It's just that I need to be gone next week. Okay? All right. All right. I've had a good time being with you tonight. Please schedule for 2 Thursdays from now. And watch for the email announcing that the video is ready to be seen tomorrow morning. I should have that out to you somewhere by around 9:30 a.m. Pacific Standard Time, Seattle time. All right? Good night, everyone.